Let's talk about the disaster that happened last week. This is a disaster that happens almost in the middle of the night.
Yes.
It's a gas explosion. And now people are injured, there is commotion everywhere. How is this hospital prepared to handle such cases of fire, especially when it comes to fire? Because we have victims having third-degree burns, others are burned beyond recognition. How do you handle such cases of emergency?
One thing that we've done as a county is through the Ministry of Health, Sector Health, which is manned by Madam Selintoy, we came up with an emergency response team. We have an emergency response center. The role of this center is to coordinate how our responses happen. This center has been trained by various partners. We have partnered with Amref, we've partnered with Red Cross, MSC, MSF, St. John's Ambulance, to train these center staff. And then we have a county centralized referral system. In this centralized referral system, we now have a coordination between the emergency response center, the hospitals, and the fire response center. Now, this is a multidisciplinary approach in terms of how we respond to emergencies. At any given time, after I joined Nairobi City County, for the last 4 months, we've had 15 drills. So
this is
in these 15 drills, what we do is we simulate different scenarios of emergencies that can come. If it's floods, we simulate if a flood comes, how are we going to have to handle it? And this is a coordinated effort between the Department of Health sector and the Department of Boroughs. That is public administration.
Yes.
When a fire happens, how do you coordinate? So we have had all this simulation. So when this fire erupted, I remember I was in the house. I had just left the hospital 2 hours ago. Then I get I get an alert, there is a fire. So the first thing we always do is, in our central hospital management team, we have allocated someone covering. Apart from the teams that are managing at night, from the top management of the hospital, there is one person managing the hospital virtually at night as the first contact person. So on that day, the first contact person was my medical superintendent, Dr. Langat. So immediately it happened, then he's alerted. Since he stays closer, he gives me a phone call. Then the first thing I tell him, respond. In less than 10 minutes, he was at the scene. And then now he starts coordinating the teams. On that night, we had to coordinate over 12 ambulances. We had to coordinate, at that time when you are responding, there's various aspects that you're looking at. You are looking at first, the victims. How are you going to evacuate them? You're looking at the security of the staff that you are having them there. You're looking at the numbers of manpower that you need in that. Because one thing you're not sure, how many people are going to come in. At the same time, you're looking at your supplies. Being in Eastlands, you have to also be very cognizant of the security of the premise, the security of the medical staff that are attending, the securities of the clients who are coming inside the facility. So there is a lot of coordination that is happening. So at that time, we are able to bring in the LCS of Soweto, Mr. Ongoro, who came in with a contingent of police just to ensure that the people who are coming in, they are well screened, we are having complete security protocol well taken care of. So that as we are working, the safety of everybody is guaranteed. Yes. Of course, we also mobilize our internal security. I had to call the governor at that time, and he responded and sent me also additional security from his office. So that at that time, we have to ensure that every team is coordinated 100% back to back.
Yes.